We're tackling an important decision for any clinic leader, deciding when to add another clinician to your group. Whether you're considering adding another physician or an advanced practice provider, this episode will guide you through the various considerations involved. We'll cover assessing the need for additional clinicians, financial considerations, and the operational impact. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 85, Need More Peeps? Deciding when to add another clinician to your group. Welcome to the Medical Money Matters podcast, brought to you by Healthy Practices. Today, we're tackling an important decision for any clinic leader, deciding when to add another clinician to your group. Whether you're considering adding another physician or an advanced practice provider, this episode will guide you through the various considerations involved. We'll cover assessing the need for additional clinicians, financial considerations, and the operational impact. Let's dive in. First, let's talk about how to assess the need for additional clinicians in your clinic. Understanding whether it's the right time to expand your team is crucial for maintaining efficient operations and ensuring high-quality patient care. The initial step is to evaluate patient volume and demand. Are your current clinicians overwhelmed with the number of patients? Are your appointment slots fully booked weeks in advance? High patient wait times and appointment availability are clear indicators that your clinic might benefit from adding another clinician. Another important factor is analyzing clinician workload and burnout levels. If your current team is consistently working long hours and showing signs of stress and fatigue, it might be time to consider expanding your staff. Ensuring your clinicians have a manageable workload is essential for maintaining high-quality care and job satisfaction. Next, consider projecting future growth. Look at demographic changes in your area and anticipate population growth. Are new housing developments or businesses likely to increase demand for healthcare services? Assessing trends in healthcare demand and service utilization can help you make informed decisions about future staffing needs. Finally, think about patient care considerations. Are there gaps in the services or specialties your clinic offers? Adding a new clinician can help fill these gaps and enhance the comprehensive care you provide to your patients. Ensuring high-quality care and maintaining patient satisfaction should always be at the forefront of your decision-making process. Once you've identified the need for additional clinicians, the next step is to dive into the financial considerations. Making a sound financial decision is critical for the sustainability of your clinic. Start by conducting a thorough cost analysis. Compare the costs of hiring a physician versus an APP. This includes salaries, benefits, and recruitment expenses. Physicians typically command higher salaries, but APPs can also add significant value at a lower cost. Understanding the financial implications of each option will help you make an informed decision. Next, estimate the potential increase in revenue from added services and increased patient capacity. Calculate the potential revenue that each type of clinician can generate. Keep in mind that reimbursement rates for physicians and APPs can differ, which will impact your revenue projections. In many markets, APPs are paid at 90 or even 80% of what physicians are paid by payers. Assess the overall impact on your clinic's budget. Ensure that you have the financial resources to support the new hire without straining your clinic's finances. Identifying potential funding sources or financial incentives, such as government grants or subsidies, can also help offset the costs. Now, let's explore the operational impact of adding a new clinician. This involves planning for changes in workflows, space requirements, and ensuring a smooth integration process. First, consider how a new clinician will fit into your existing workflows. Planning for the integration of a new clinician into existing workflows is crucial to avoid disruptions. Assess the impact on support staff and administrative processes. It's essential to ensure that your team is prepared to accommodate the new additions smoothly. Next, evaluate the need for additional office space, exam rooms, and equipment. Adding a new clinician may require renovations or the purchase of new equipment. Planning for these needs in advance will help ensure that the new clinician can start working efficiently from day one. And be sure to start credentialing and contracting work a full 6 to 9 months before you'd like the new clinician to start seeing patients. This way, you can assure that they will be paid for the patients they see right from the outset. Lastly, develop a comprehensive onboarding plan for the new clinician. Providing necessary training and support will facilitate a smooth integration into your clinic. An efficient onboarding process helps new clinicians understand your clinic's culture, policies, and procedures, setting them up for success. Now, we'll delve into the crucial decision of choosing between adding a physician or an advanced practice provider, and provide a decision-making framework to guide you through this process. Deciding whether to add a physician or an APP to your clinic involves several key considerations. Let's explore these factors to help you make the best choice for your clinic's needs. First, it's essential to understand the roles and responsibilities of physicians versus APPs. Physicians, with their extensive training and expertise, can handle a broad range of medical cases, including complex diagnoses and treatments. They can also perform surgeries and specialized procedures. On the other hand, APPs, which include nurse practitioners and physician assistants, are highly skilled and can manage many aspects of patient care. They can conduct physical exams, diagnose and treat illnesses, prescribe medications, and provide preventive care. However, their scope of practice is generally more limited compared to physicians, and oversight requirements vary by state. Review state and federal regulations regarding the use of APPs. Each state has specific licensing requirements and scope of practice laws that define what APPs can and cannot do. Ensuring compliance with these regulations is crucial to avoid legal issues and provide safe, effective patient care. And if you haven't had an APP in the practice before, this is a philosophical discussion to have with your partners first. Match your clinic's specific needs with the skill sets of physicians and APPs. If your clinic requires specialized services or has a high volume of complex cases, a physician might be the better choice. For primary care or managing routine patient visits, an APP can be highly effective and cost-efficient. Assess patient preferences and expectations. Some patients may have a strong preference for seeing a physician, while others may be comfortable with an APP. Addressing potential concerns or misconceptions about APPs is essential for maintaining patient satisfaction. Educating patients about the qualifications and capabilities of APPs can help build trust and acceptance. Now that we've discussed the differences between physicians and APPs, let's outline a decision-making framework to guide you through the process of adding a new clinician. Start by developing a step-by-step process for evaluating the need for additional clinicians. This framework should incorporate data and feedback from staff, patients, and stakeholders to ensure a comprehensive assessment. Perform a SWOT analysis to identify the strengths, weaknesses, opportunities, and threats of each option. This analysis helps you objectively evaluate the benefits and challenges associated with hiring a physician versus an APP. Develop a detailed business plan that includes financial projections, operational plans, and risk assessments. Outline the anticipated costs and revenues, integration strategies, and potential risks. Present this plan to stakeholders for approval and buy-in. Having a well-thought-out business plan demonstrates the strategic value of your decision. Once a decision is made, develop an implementation timeline and action plan. This plan should include key milestones, responsible parties, and deadlines to ensure a smooth transition. Monitoring and evaluating the impact of the new hire on clinic operations and patient care is crucial for making necessary adjustments and ensuring success. To recap, we've covered the crucial decision of choosing between adding a physician or an APP and provided a decision-making framework to guide you through the process. By understanding the roles and responsibilities, regulatory considerations, clinical needs, and patient preferences, you can make an informed choice that benefits your clinic and patients. I hope you found today's episode valuable. If you have any questions or need further assistance, please reach out to Healthy Practices. We're here to support you in creating a healthy, efficient clinic environment. Thank you for joining us on the Medical Money Matters podcast. If you found this episode helpful, please subscribe, share it with your colleagues, and leave us a review. Your feedback helps us improve and reach more listeners like you. And as always, feel free to reach out to Healthy Practices for expert consulting services. Follow us on social media, visit our website, and stay tuned for more insightful episodes. Join us for our next episode where we'll delve into the impact that AI will have on medicine. You can find more information online at medicalmoneymatterspodcast.com, and you can also find examples in my book, Physician Heal Thy Financial Self, which is available on Amazon. We've included those links in the show notes. As I like to close out these podcasts, congratulations on taking the next step in your professional development and for making the commitment to learn about the financial and business aspects of your practice. I look forward to being on this journey with you, and I send you my heartfelt gratitude for all that you do for your patients all day, every day.